The trend in substance abuse today is quite different and remarkable compared to the previous 4 decades. So when people ask me about what is the trend in substance abuse, what substances are being used, what we need to do is kind of look at our history, and that tells us a lot about where we're at today. For an example, drugs have decades, drugs have seasons, drugs have periods where they come in and they're popular and then they go out of style, new ones come in, they go out of style, then the process just continues. Starting in the 60s, this was a time of great upheaval in the country. We were going through civil rights and the Vietnam War and a greater move toward a technological age, and drugs like LSD and a lot of marijuana and heavy alcohol and heavy nicotine were really the drugs of choice during those years. Then we found from 1970 to 1980 that door opened up even further, and other drugs such as heroin as a result of the Vietnam War and cocaine based on the climate and what was going on in the country became very much drugs of higher abuse. This was also the years during the 70s and 80s that there seemed to be a lot of stress in the country, and we had certain events going on, and the adaptation of tranquilizers really came in and were used heavily. In fact, an estimate was done that sometime between 1975 and 1980, 75% of all Americans were taking something, which is just a staggering figure. Into the 80s, because we saw economics change, lots of credit, lots of kind of invisible money, free money, cocaine and freebasing it, and crack cocaine were the hallmarks of what the country were using. And the reason was because it was kind of an enlightened period. It was a time of good times, so to speak, and lots of credit and spending and economic growth. This continued into the 90s, and new drugs, new stimulant drugs such as methamphetamine, amphetamines, MDMA, which is ecstasy, a combination of both amphetamine and hallucinogenic. These came in as cheaper supplements to cocaine, ones deemed safer than smoking, quote, crack. Also, other things just during that period of time that really played into it was the fact that we had diseases going on that we didn't know about ever before that, namely AIDS and HIV. And people didn't really know what it was. It just came out of nowhere, and it was killing people and killing certain populations, and it was soon associated with particular drugs led to possibly getting this condition. And then in the late 80s and 90s, they confirmed it. Shooting up or IV intravenous drug use was a direct link to getting HIV or possibly passing it. Therefore, as we're moving up through the decades here, using intravenous drugs was no longer acceptable. So smoking once again became the primary choice of drugs. Smoking cocaine, smoking marijuana, smoking methamphetamine, and lo and behold, the heroin market suffered a beating because of shooting up. So what did they do? They made a drug, or produced their drug in a fashion that could be smoked. And instead of calling it heroin, they made it exotic and they called it opium. And as a result, people started smoking opium. And it's about this time that the climate of the country economically shifted, and we started to feel a depression coming on. Economic depression, we entered into some wars, changing of presidencies, and as a result we ended up with not just a problem of depression, clinical depression in the United States, but we found that we have a global problem of depression. And whenever we get to periods of this, people abuse depressant drugs. So what has taken place over this past 40 years is we've evolved to a place where we have economic woes, we have wars going on, we have a smaller world that is intricately more connected, and everything's kind of right here, right now, real time, up in your face, and we have a global problem of depression. So what has increased tenfold? Alcohol use and the use of heroin, smokable form heroin, and also the use of tranquilizers, a form of a depressant drug or a sedative, and pain pills.